JoyNews Prime with me, Samuel Kojo Brace. In our bulletin tonight, flood victims of Mefe in the North Tongue District of Water Region cry neglect as menstruating ladies claim to have gone days without bathing.
How they bath, change themselves, nothing. They can't do anything. So maybe they'll be in one part. As I'm talking to you now, me myself, I'm also a victim.
Details as the National Disaster Management Organization, NADMO, and Emergency Management Committee maintain they are on top of the issue. Also coming up, calls for probe into the questionable COVID-19 airport testing contract. As fresh information reveals, Ghana got less than $7 million of the nearly 19 million realized from the test. We'll interrogate the decision to select a private company for the contract when other state agencies, such as Noguchi, have the capacity to do so. Experts say the use of mercury by illegal miners to trap gold exposes people, especially pregnant women in mining communities, to life-threatening concentrations. We have more in our latest hotline documentary titled Poisoned for Gold. Now, there's more anger after the Ghana Airport Company released details of the airport COVID-19 testing nearly a year after JoyNews put in an RTI request. The company refused to release the details for many months and only did so after the RTI Commission slapped a 200,000 cedi fine on them. The details explain why Ghana made around 8% of the total earnings, with 92% going to Frontiers. Let's share with you some of the details we picked from this particular report there. Now, if you check the details in this particular report that they released to JoyNews, it indicates that Frontiers got $84 million from arrival testing and an additional 29 million cedis, that's $3.5 million from departure testing. In stark contrast, Ghana received a sum of under 6 million from arrival testing and 1.5 million, that's 1.5 million cedis, equivalent to $180,000 from departure testing during the same period. This disproportionate revenue distribution shows that Frontiers claimed over 90% of the earnings, retaining 92% of income from arrival testing and a significant 94% from departure testing. Now, head of research desk at JoyNews, Raymond Aqua, joins me in studio with more on this. Now, he put in this particular request, which has given us this detail. Raymond, so you put in that request. We've shared this bit of what the report says. What more do we have in the report?
So one of the first questions we asked was that we wanted to know the arrangement they had with them, be it a contract, an agreement, and whichever leases are attached to this. They agreed. They actually said they have supplied to us and some of the documents. The first one is an agreement between Ghana Ports Company Limited and Frontiers Healthcare for the provision of COVID-19 testing at the Upper Arrival Terminal 3. This is September 2020. Okay. Now, there's another one, an addendum to the agreement between the Ghana Airports Company and Frontiers Healthcare Services. So this is Ghana Ports Company Limited and this is Ghana Airport Company. The difference, and Frontiers Healthcare Services for the provision of COVID-19 testing.
Are there two entities here?
Yes, separate ones, but they work together. The airports company and also the ports is what we are dealing with here. Now, let's look at this properly here. June 2021 is for first September 2020. Second one is June 2021. The very last one is the license between the airport company and also Frontiers Healthcare Services, which is on February 2021. So there was an initial agreement in September 2021. February, there was a license between the two used as COVID drive-through for PCR and antibody center at KIA, Car Park 4. And the last one is the addendum to the agreement that was given there. These three were supplied. Then we came to the next question that we asked about which processes they used. We wanted a chronology of the processes that led to the selection and award of the contract that we're talking about here. They then responded by referencing us to some committee content that was provided by the minister who is in charge of transport during his vetting, Kweku Ofori Esiama, on the February 23 and 2021. This is a Tuesday we are talking about. They first said he went to the committee and told them that the FDA had given confirmation of the equipment used by Frontiers. Okay. But before that, they said, and this is what they stress, that what was done at the KIA, the role of the Ghana Airport Company was only to rent space to Frontiers Healthcare Services.
Okay.
Now, what did that entail? They moved on to say that in July and August 2020, the president announced government's inclination to reopen the borders of the nation to commercial air traffic, subject to the availability of an effective system for COVID testing. Then following this, Frontiers now came to government. You see where the difference is? Frontiers now expressed their preparedness to provide such service to the public while indicating that its equipment have been tested by the FDA, and then the Ghana Airport Company moved beyond the mere words of Frontiers and went to check with the FDA whether they are tested that. Why is it important? You know, along the line, there was questions raised about the Health Facilities Regulatory Authority not giving the necessary approval.
That's HEFRA.
Yes, HEFRA here. Not giving the necessary approval for the place to be used. Then they moved on to say that the minister, having explained, then said that in August 25, 2020, the FDA now wrote to the Ghana Airport Company Limited, indicating that approved the equipment to be used. Now they moved on to talk about the procurement process. Now he says the man informed the appointments committee that following the receipt of the information, intending to enter into an agreement with Frontiers, the Ghana Airport Company now wrote to the Public Procurement Authority to seek approval for the executing this agreement. The response, which was given according to their statement on August 26, 2020, the PPA replied to the airport company indicating to them that the rental of office space by the airport company to another company fell outside the scope of the Public Procurement Act.
Okay.
So they had to use their administrative processes to actually fill in the gap and actually engage the grouping Frontiers here. Now, that was one of the questions we asked, and they proceeded to talk about what happened with all the engagement. So they wrote to them, and their response was that you do not need public procurement processes to follow, because the other issue that has come up was that they didn't follow the processes that we have all laid down. Indeed, there were even questions about others equally expressing interest. So if they had gone through procurement, perhaps they would have taken on board all of these options and proceeded with it. Then we asked about the total amounts. And just as you put out there, we separated because we did not only want to know how much has been generated generally. We wanted to know how much went to Frontiers and how much actually went to the Republic of Ghana. Then we also wanted to know for each of the strata, arrival and departure, all of the arrival, what they call it, amounts were in dollars. So that's why they told us in total, some 90 million, 655.91 was the total amount in dollars for the arrival testing. Okay. But for the departure testing, it was in cedis. Okay. 30,711,600 cedis. If you break it down, that's what you mentioned early on. The arrival testing and the amount that was given to Frontiers was 84,16,500. Then in cedis, the CD part, which is the departure testing, is 29,176,020 cedi. Now, when it comes to the Republic of Ghana, we got 5.999749 million, less than 6 million for the arrival.
That's dollars.
Yes.
Arrival.
And for the departure. It was 1.535580. Wow. A little over 1.5 million cedis. That's how much. So you compare the 1.5 million cedis to the 29 million, and you compare the 84 million cedis to the 5.9 million, being the differences between the two. One is over 90, one is less than 10%. Interesting details there. Well, so that's a work put together by our research team. Now, we've also been joined on the phone by Okudzoto Blakwa, who has been at the forefront of the crusade on this particular deal. Grateful for joining us. We also have a pharmacist and CDD fellow, Dr. Kwame Sapon Asiedu, joining us as well. But let me start with Honorable Okudzoto Blakwa. You've been on this, crusade for quite a long time. What do you make of the findings so far?
Well, good evening to you. Good evening to all your cherished viewers. It is important to commend Joy FM for your determination, for the consistency. It has not been easy getting this information. You even had to get the RTI Commission to fine the Ghana Airport Company Limited. Ghana Airport Company Limited must be condemned for the way went to conceive.
You look at the sharing ratios. Do we still have? Okay, so we lost Okujuta Blackwell there, but we'll try and raise him back on the line. But Raymond, so if you look at the sharing ratios that you put out there, were there any reasons given as to why Ghana settled for this kind of ratios?
So the response as to specific amounts are actually hinted at within the first, to be fair, within the agreement that they settled. But there's a bit of this that says that because we rented space to them, they were paying royalties of $10 per every cost of testing.
Okay.
That happened.
Okay.
So I recall that in December 2020, I paid $150 arriving in the country.
Yeah.
So out of the $150 at the time, they took $10 for the
Rent.
Ghana Airport Company Limited. And the 140 went to Frontiers.
Okay.
For the act. Along the line, there was a lot of noise made about whether or not this is fair, whether or not this is should we continue. Then it was revised. So we indigenous were asked to pay lesser than foreigners in this particular case. Indigenous were paying about $50, which required that they still were given the $10 to the Ghana Airport Company or the government of Ghana, and the rest will be going to the grouping there.
Okay.
There isn't a definite clarity on why those two amounts were settled on. In fact, it's repeated in the agreement that this is the amount we'll be paying to government at every level or for every single testing that you did. None of the details given here, and we asked the question about which process did you use and how did you settle on this, which is key though, to establish what the real intent behind the decision to select Frontiers in the first place. The suggestion being made here was that Frontiers approached us. Hearing, for example, the president's announcement. Was Frontiers any company at all that approached? Indeed, was it the only company that approached government and was interested in some of these, what they call processes?
Okay. We have the Honorable Okujuta Blackwell back on the line. So I wanted to understand from you what you do make of the sharing ratios as put out.
Clearly, the sharing ratios confirm what we had intercepted. And we had made the point earlier that this whole deal is a rip-off. This whole deal does not have value for money. It does not put the interest of Ghanaians ahead of the interest of private buccaneer entrepreneurs. We have always maintained that this whole Frontiers arrangement was a classic trade loot and share scheme, which was intended to, as it were, amass wealth for a few crony capitalists. And this is a clear confirmation. Look, fundamentally, we must be asking, how is it that in a country that has reputable organizations like Noguchi, like KCCR, like the Kolebu Central Lab, who were at the forefront of the COVID fight, how did it happen that this company, which was formed on the 21st of July, less than 2 months before the airport was opened, just a few days actually, how did this company become more credible? How did this company come to be preferred to carry out this testing? When we have all of these credible organizations and see how much they have raked in as profit, imagine what that money could have done for Noguchi. So this is a company that has no track record. And you see, the response that you have received, that Joy FM has received, it confirms that this was an insider deal. How did Frontiers know that that government was about to have this arrangement, this airport testing arrangement, and that they will use the upper terminal? It will be exclusive. I mean, clear insider dealing. Because they confirmed that they did not advertise. So there was no advertisement. There was no call for expression of interest. And yet, Frontiers, which had been incorporated a few days prior, knew that this was going to happen. They knew exactly who in government to contact. I mean, incredible. Look, this is classic insider dealing. Then number two, when you go through the responses that have been provided, instructively, the Ghana Airport Company Limited keeps a very vital information away from us. And what is that vital information? The passenger statistics. We are not told how many people came in during the period, because that is how we are all able to know how much exactly. Because the analysis that I have done based on the passenger statistics published on the website of Ghana Airport Company Limited, that figure of $84 million, even though it is so, the disparity is so wide and Ghanaians are outraged, I tell you that it is even understated. Because if you look at the Airport Company Limited website, the passenger statistics published, what has been put out is grossly understated.
Okay.
Number three, it is important to emphasize that this whole arrangement, this whole Frontiers arrangement, there are so many illegalities. They have confirmed that at the time this testing began, they did not have the license to do it, license from HEFRA. The Health Facilities Regulatory Authority had not licensed Frontiers, and they allowed this illegality. That is why I am convinced that, look, a forensic audit, an independent probe, and that's why we have filed this motion in Parliament, which the Speaker has duly admitted. We believe that an independent inquiry will bring out a lot more issues, and will have this whole whitewashing, this whole cover-up exposed.
Let me bring in Dr. Kwame Sapon-Siedo here. Doc, if you look at the sharing ratios, how different do you think it could have been done?
The issues are bigger than just the sharing ratio.
Okay.
Because if you look at the documents that Joy has put out, the airport company is telling us that they rented the space to Frontiers. We know that the regulator, which was FDA, licensed Frontiers and certified the equipment and all that. But who did Frontiers go into a contract with in Ghana? Which entity to take biological samples from passengers coming into Ghana and test them? That information is still unknown. Because the airport company are not telling us that they had a contract with Frontiers. And my little understanding of biomedical testing is that you just cannot go into a country and start testing people. There are ethical considerations to those testing. So who had that contract? Because that person would be the person who agreed the sharing ratios. Unless, of course, we are going to glean from the information that has been put out by the airport company that by virtue of the fact that they accepted the ratios, there was by default a contract. But if you read the substance of the information they've given to you, they are saying there was no contract. It was strictly them renting their premises to the testing company, which was Frontiers. So that is a huge gaping hole, and that contributes to the conversation around the ratios. Because if you don't know who agreed those ratios, how do you have the conversations around them?
But so looking at the responses we've gotten so far, what are the critical issues that should serve as a guide in future dealings of that kind?
Well, the critical issues are first and foremost what I've said, that there needs to be a contract in place. Even when you want to do biomedical research, you've got to go for ethical clearance. It is box standard in biomedical research. So there needs to be a contract in place that allows that testing to take place. That is one. Number two, don't you find it surprising that all the ministers who went to vetting at the time that this contract was in controversy denied knowledge? Having read the documents now, I understand why they were doing that, because they were all embarrassed about the content. If you ask me, this is the worst contract I've seen signed by anyone who says he's a Ghanaian in the name of Ghana. How on earth would you sign a contract which says that the person who is coming in to test, for whom we don't know who he had a contract with to come and do the testing, is taking 93.7% of the foreign earnings that are coming in, and you are taking 6.7%. And the 6.7% technically is not going to the state. That's what the airport company was taking.
Yes.
And we have biomedical research institutions. We've got Noguchi, we've got KCCI, we've got Kintampo, we've got the veterinary unit, we've got, Navrongo, who need money for research. And we know the value of biomedical research to any economy and how important it became at the height of COVID, that it even played a part in who got vaccines first and all that, because he who pays the piper calls the tune. And we go into a contract like this. For me, that is the biggest learning for us, that next time we should think inwardly about our research institutions and any benefit they can accrue from such contracts. Like it's always said, never let a crisis go waste. And I believe from the information we've seen, we've made this crisis go waste.
Let me bring in Okujoto here. If you can do this for me in a minute, I'll be happy. You have been linking this contract to the people behind the development of the airport city. What do you know?
Yes, definitely. I can confirm that the same guys who fronted for Frontiers are the same people who are behind the Heaven Builders deal, which, as you know, is another create, loot, and share scheme. They have been offered 38 acres of Ghana airport land. They have made a counter offer for 62 acres, and they are saying they want 99 years lease period, not 45 years as they were initially given. We followed up. The address that they provided, the office doesn't exist. It's an abandoned, decrepit structure, totally ramshackle. Their website does not address. Their website address they provided doesn't exist. So if due diligence had been done, they will have known that this company, which has a stated capital of 5,000 cedis and one employee, cannot claim to have $85 million for land which is in excess of $254 million. And if you look at the addresses and then the witness, those who witnessed for both companies, if you look at the articles of incorporation, it's the same person. So we are seeing clear, similarities, the same people. And insiders have told us that those who come to negotiate this deal are the same people who came to negotiate the Frontiers deal.
Thank you very much. Dr. Sedu, before I let you go, would you support this probe that Okujoto, Ablakwa, and the minority are calling for?
Yes, I'll support a probe into this on the basis of what I've read. Absolutely. Because, like I said, there's a huge gaping hole about who actually Frontiers were in a contract with to actually do this testing. And until that is unraveled, we are still in a lot of gray areas.
Thank you very much. This is still JoyNews Prime. Now to other stories. Over 3,000 residents who have been displaced and have been evacuated to safe havens in Kizilto school premises in Mefe, in the North Tong district of the Volta region, lament the harsh conditions at the various emergency assembly centers. The Volta River Authority commenced the spillage of excess water at the Akosombo Hydro Dam on September 15, 2023, due to rising levels of the dam's water, which led to flooding in some 9 districts. Speaking to Joy News during the donation of some relief items by the Volta River Authority, the flood victims say conditions at the so-called safe havens are dire. Some of the victims have been speaking to my colleague Carlos Caloni.
Now, this is the only thing I have. My cooking utensils, everything got drawn. Even our roofing sheet is very small for the roofing sheet to start showing. You can't even see the roofing sheet again. So we are pleading. Even our school fees, we don't have anything. The small that we have that we will use to support ourselves has finished. So we are calling on the government to come to our aid. Otherwise, we don't know where to start and where to end it.
So you've been here for how many days?
A month now.
I mean, the situation that happened, they brought you to this school?
4 days. 4 days now.
Tell us the experience here.
Oh,
Place to bath, I mean, where to poo and...
the bathing there, I can't remember the last time. Since the thing has started, I've never bath. Because there's nowhere you fetch the water to bath. Even the water that you can't even fetch, not to talk of bathing. That's the whole thing. And some of the ladies, they are in their menses, and how they will bath, change themselves, nothing. They can't do anything. So maybe they'll be in one part. As I'm talking to you now, me myself, I'm also a victim. Thank you.
So share with us the fact that you are sharing the same room with different people that you don't know, cross-infection and all that.
Because of how the flood is moving, when you hear that it's somewhere here, you need to move to the other side. If it is here, you have to move to party B. We are just running, just to save our lives.
Okay.
Now, the victims say they would prefer a relocation to the Sagleme housing unit. Matthias Agbenyo Nomenyo is the assembly member for the Dogome electoral area.
As I'm talking to you now, over 7,000 people have been affected. There's nowhere to cook. The community, especially the cemetery sites, the toilets, they haven't been submerged. So it affects the water entirely. So now when they bring food items like this, where to cook those things becomes a problem. So we want government to set the people with hot meals thrice in a day. For sure, the spillage continues. So we don't know where it will land us. So we know there is an affordable house at Chopoli over there. It is better the government convey everyone over here to a safer place there, so that we can stay there for a while. When this problem is over, we can come back to resettle over here. So this is what we are demanding the government to do for us. Come and convey everybody, take to Chopoli, the affordable house over there, for us to stay there and then live comfortably.
While speaking to Joy News, Deputy Director of NADMO, Saji, assured that concerns are being addressed.
The issue is that as safe havens, we are trying as much as possible to provide all those facilities to make their stay there, give them some comfort. It will not be like their homes, but we are trying to get that done. We know that some of the safe havens don't have those washroom facilities, but we are trying to get something done about that. I told you about the Director of Health working to have some of the nurses in some of the safe havens. As I even speak, there are some of the nurses at some of the safe havens attending to the health needs of those victims at the safe havens. So far, we have recorded very high numbers already. And the way things are going, we are likely to record more numbers. So far, in all the 6 safe havens in North Town, 14,000 people, that's the population, they say 14 to 17,000 for the population of Mefe. So a quarter of Mefe, which is being inundated now, those along the river banks, we are looking at in the region of about 4,000 getting to 5,000. But when the situation subsides a little, we might be able to put out more accurate figures. But those we have in the safe havens are getting close to 3,000, and we are likely to record more because we are told that the spillage might not go down anytime soon. Maybe we might have another 4 or 5 days to 1 week to go.
Meanwhile, handing over of some relief items to NADMO officials at the North Tongue District Assembly, the Deputy Chief Executive Officer of the VRA in charge of services, Engineer Kenneth Arthur, asserts that the VRA is committed to bringing relief to affected persons throughout these trying periods.
The impact of the dam spilling is quite adverse over here at the lower Volta. VRA has already collaborated with NADMO to bring some relief items. But what you are seeing now, we seek to intensify our humanitarian efforts to bring in more relief items. So that is what you're seeing here. So basically, we are targeting 9 districts in all. We joined NADMO to donate the first batch of items at Central Town, that's at Didobe. We are here now at North Town, and we'll be looking at the other districts. So basically, we have food items like rice, mackerel, and then some cooking oil, and then sanitary things like toilet rolls, etc. These are, different items that we're sending to different areas. I must also say that we have a water tanker in the locality, that is supplying potable, clear water to all the affected people, especially those who have been moved to the safe havens, as well as the households who need that service. We have promised that we are going to be with the people until this storm is over. As I said earlier, we've already donated to NADMO, to supply some relief items, and we are intensifying it, as you can see here. So we are committed to make sure that throughout the storm, we bring relief to the people who have been evacuated from their original homes until this flood recedes.
Still on floods, residents in the Three-Tongue district and Anlo of the Volta region are counting their losses after their homes and businesses got flooded due to the spillage of the Akosombo Dam. Most of the residents who said they lost their properties are currently homeless and appealing to the government to come to their aid. Komboni technical students have been sent home due to the flooding. Ivy Setoji has an update on the issue.
In Bakba, Avaduwe, Kome, in the Central Tongue district, the entire community is flooded with most of the houses submerged. Some of the residents who spoke with Joy News said there is a need for government to respond swiftly to their cries before the worst happens.
Our concern as residents is why is it that knowing that the impact will be greater than the previous year, they didn't put up any form of support system to ensure that the people are safe, that the people are not, will not go through what they are going through now.
From what we are seeing, a lot of families have lost a lot of things.
In South Tongue, the power distribution station is also affected, and the Komboni Technical School also flooded, forcing authorities to send students home. Ignatius Banya is the vice principal of the Komboni Technical School.
At the moment, as you can see, the effect of the spillage from the VRA dam submerged most of our facilities. And as a result of that, when we noticed yesterday, we have to ask the students to go home.
In North Tongue, the assemblyman Amos Ahosu said over 1,000 houses have been submerged in the flood in Mefe, Aveime, and its adjoining communities.
Over 1,000 houses have been submerged already, and the parties and then life is being threatened. So we are calling on the national. The government should come to our aid. This is the time the people of Mefa, especially the people at the lower Volta basin, are waiting them. They should come to our aid. The people, they need tents. They need tents, a temporary tent to stay in. They need mattresses, the food stuffs, mosquito coils, mosquito nets, and all that. All those things are being needed now. Whatever that can help us, any relief items at all, is welcome.
Osborne Divine Fenu is the DCE for North Tongue District.
We just returned from Aveime Riverside to take some relief items to our people over bank. We have some relief items delivered to them this afternoon. We are moving to other places.
In Anglon, towns like Agobledokui and Fiaho are also flooded, leaving residents homeless. It is the hope of the people of these communities that something be done about the situation soon. Ivy Setoji, Joy News, Mepe.
This is still JoyNews Prime. We'll take a quick break. We'll be back with more. Stay with us. Welcome back from the break. Now, some illegal miners in Ghana currently use mercury to trap gold. The mercury is then vaporized by continuous heating on fire. Experts say a test conducted in gold smelting joint in the country reveal that the vaporized mercury stays in the air, exposing people, especially pregnant women in such communities, to life-threatening concentrations. This is captured in the latest Joy News Trust Africa Hotline documentary, Poison for Gold, produced by Erastus Asari Donko, airing on Monday. Here are excerpts.
At Konyao, a small farming and mining community in the Bekwai municipality of the Ashanti region, Kofi Asari works as a gold dealer. He heats the gold mercury amalgam he gets from these artisanal miners with a blowtorch or sets them on fire to vaporize the mercury in obtaining the gold. The process produces a poisonous, white, foggy-looking vapor which fills the immediate environs. After 8 years of doing this job, he suffered a major health blow.
I was at work. I saw that my hands was shaking, my body was shaking. I couldn't even stand my hands for some. You see, it's shivering, but that time it was very high. And I can't even hold pen to write. I can't even hold phone, hold water to drink. My intestines were the same. I feel like something was inside my body. I can't take food. If I take food, I used to vomit.
But Asari is not the only person exposed. He is silently poisoning the entire community. The mercury vapor eventually settles in the surrounding environments, such as in the air, water, sediments, and soil.
Mercury in air, it is one huge challenge that we are being faced with.
Dr. Eugene Ansa is a scientist in charge of the Sheath Laboratory of the Chemistry Department at the Kwame Nkrumah University of Science and Technology. He has been using a mercury air analyzer to test for mercury air concentration in communities where gold smelting is done.
What we saw was that most people were exposed indirectly to mercury vapor, farther away from the point source, that's the point of application or the point of amalgamation and roasting.
Professor Sampini explains how heavy metal contamination can alter the developmental stages of a fetus, leading to extreme deformation in babies.
Either by inhalation, the mother will inhale it, goes through the blood, and then the child gets it through the placenta. In fact, placenta is one of the organs that has a very good permeability for heavy metals, especially mercury and then lead.
Now to other stories, and despite misgivings by some political and social actors about the Electoral Commission, President Akufo-Addo is affirming his confidence in the Commission and the processes it is undertaking. According to him, Ghana's electoral system has evolved over the years to become reliable, and there must be a need to protect the Commission. Speaking on democracy and security in West Africa at the United States Institute of Peace Program on Governance and Peace, President Akufo-Addo says democracy, despite its imperfections, remains the best tool to fight injustice in the governance system.
We have in this period experienced through the ballot box the transfer of power from one ruling political party to another on 3 different occasions in conditions of peace and stability without threatening the foundations of the state. The Ghanaian people have manifested in this era their deep attachment to the principles of democratic accountability, respect for individual liberties and human rights, and the rule of law. It has also brought with it more or less systematic economic growth and boosted immensely our self-confidence. We're making systematic advances, especially if you consider that we have just celebrated our 66th independence anniversary, and we're able to say that we are indeed making significant progress. For the first time in a long while, young people can make long-term plans and live out their dreams without interruption. In much the same way, businesses can think ahead, begin to think big, and be certain that the laws of the country are not subject to capricious changes. We're all much more relaxed in the knowledge that we live under a regime of the rule of law, and that when disputes arise, as they would in all human endeavors, they would be settled fairly. We have not gone to this stage easily and without difficulties. If I were pressed, I would mention in particular the electoral process as the greatest source of potential instability. The trigger for many wars and disputes around the continent can be traced to dissatisfaction with the conduct of elections. We in Ghana have gone through our own traumas about elections. There have been boycotts, there's been anger, and there have been famous election petitions before the courts.
That's Esther JoyNews Prime. We'll take a quick break. When we return, we'll bring you Prime app. We'll bring you Showbiz.